Welcome back, everybody. Holiday parties can be as plentiful as presents leading up to Christmas, and throughout all the gatherings and celebrations, it is important for people to remember overdoing it can take a toll on their heart.
Yeah, in fact, during this time of year, emergency rooms tend to see more patients coming in experiencing something known as holiday heart syndrome. So here to explain more about what that is and some ways to stay healthy during the holidays is Dr. Leticia Castillo Kontak with Baylor Scott White Cardiology. Doctor, thank you so much for being here on the week of the holidays. We know you have quite an important message for folks.
Thank you for having me. I appreciate it. And I'm here to talk about holiday heart. It's a very common syndrome that occurs during the holidays. In particular, it's an irregular heart rhythm known as atrial fibrillation that can increase the risk of strokes. And the reason that it happens is because of overindulgence with alcohol, as well as sodium and stress.
All the things we experience during the holidays, I think that list is going to feel really familiar for people.
Yeah, and what is it about some of the things that people overindulge in during the holidays that causes this to have something they experience?
Yeah. So in particular, alcohol is a diuretic. What that means is it tends to dehydrate people. And when you get dehydrated, a lot of the times you lose electrolytes such as magnesium and calcium, which are important for the regular and normal function of the heart rhythm. And when you become dehydrated, a lot of the times the low magnesium and calcium can lead to this irregular heart rhythm. It's also thought that perhaps increase in sodium can raise people's blood pressure, lack of sleep increases stress hormones, which can lead to the heart arrhythmia.
What are some symptoms that people might experience prior to or leading up to that they should maybe be aware of in their own body? Are there things that you could say, ooh, this might be happening to me?
That's a great question. In particular, if you have the sudden onset of racing heartbeats, feeling like your heart's pounding out of your chest, the sudden onset of shortness of breath or chest pressure, feeling lightheaded or near faint, definitely is something that should be of concern, regardless of your age.
And we, of course, don't want to dampen the type of fun that people have during the holidays, but talk to us about some of the ways that we can all better protect our health this holiday season.
Yes. So the American Heart Association actually has guidelines in terms of alcohol intake. And in particular, what tends to increase the risk of holiday heart is binge drinking. What that means is more than 3 drinks in one sitting. And so you can still enjoy a drink. For women, the guidelines recommend no more than 1 drink per day, and for men, no more than 2. So one way to reduce your risk of holiday heart syndrome is to perhaps know your limit and know the guidelines in terms of how much alcohol. Also staying hydrated, making sure you get plenty of sleep, making sure you don't overindulge in excess salt and sugar are very important.
Yeah. Talk to us a little bit about why this is so important, caring for your heart. What are some of the other impacts that this condition can maybe bring on to someone's health?
Yes. So we talk a lot about the holidays being Christmas and New Year's, but they actually tend to see an increase in the emergency rooms during pretty much any holiday. And so I would say, again, watching out for excess sodium and alcohol intake through any holiday, making sure that you do see your doctor if you have increased risk of this arrhythmia, and in particular patients over the age of 65, patients with high blood pressure or a condition called sleep apnea. I would say just routine, regular doctor's visits are important to make sure that you diagnose those risk factors.
And if someone experiences holiday heart, what is the treatment option for them?
Yes. So if you have an irregular heart rhythm with a rapid heartbeat, first things first is go to the emergency department. In the emergency department, they can give medications to slow the heart rhythm down and medications that can help treat it in the long run. With proper treatment, patients will do well. You definitely want to catch it early because it does increase the risk of stroke and in some patients increase risk of heart failure.
Dr. Leticia Castillo Kontak, thank you so much for being here. Such good reminders for folks as they start to maybe make their menus for holiday celebrations. They can make a tweak here, a tweak there. We so appreciate your insight.
Thank you for having me.
And happy holidays.
Happy holidays.
We'll be right back after the break.